heard of melanoma, but chances are that you don't know everything you need to stay safe. It is a very, very tricky disease. If you're with us regularly here, you might have heard me mention that I am a melanoma stage 3 survivor, and it's been 4 years now. There was a lot I didn't know about this most dangerous form of skin cancer. Our resident doc, Srini Iyengar, is here now to kind of sort it all out for us. There are a lot of myths here too, right, doctor?
Definitely. And like I said, first and foremost, Jerry, obviously you've made it through. You're a survivor of this. And I think, people will take it to heart that you can talk a little bit more passionately about this than others because you went through it.
Absolutely. And the word survivor too, sometimes I'm a little reticent to use because you're not really out of the woods ever, but you're more out of the woods after 5 years. So in about a year and a few months, I'll really feel comfortable calling myself a survivor. But let's talk about this. Now, most people think that melanoma will strike you if you are fair-skinned or light-haired, red-haired. Not true.
Not true. And the thing with melanoma is that it's not the most common form of skin cancer. We know squamous cell, basal cell.
Right.
The thing is, melanoma, though, is probably the most lethal form of skin cancer. And that's the really important thing to take home here is that melanoma doesn't differentiate between skin types like we've just mentioned. The most common form of melanoma will be from UVA radiation or from light exposure. We can see that in basically most people who have that type of overexposure to either tanning beds or even outside in the sun too much.
But it's not always as a direct result of sun exposure, is it?
It is not. And there's also family, hereditary components of this as well. And again, we were talking before the show about children who get burnt as a young child. By damaging the dermal layer of your skins, you're more prone to developing these types of problems later on.
More prone to and at risk to get melanoma if you are burned just once as a child. So really take that to heart, because if you're not putting sunscreen on your children or dressing them properly out in the sun, this is not cool.
This is exactly, and the thing is, just like we said, you don't have to be light-skinned and fair-skinned and be from a northern hemisphere type of environment to develop this. Now, one of the things we also mentioned, one of the most famous cases, but one of the most unfortunate cases, Bob Marley.
Bob Marley.
He had acral lentiginous melanoma, and he had bruising around his toe, which was diagnosed correctly. They diagnosed it with melanoma, but according to his religious beliefs, did not want an amputation or excision of the area. Hence, it spread and became metastatic, and he basically passed away from that.
That's right.
So the main concern here is that diagnosis. If you make a diagnosis early, you can treat it and cure it.
And it doesn't matter your skin tone.
It doesn't matter
if you're black, white, whatever color you are at risk.
Exactly. And the ABCDEs, these are what dermatologists preach, what they see in their office. What that means is that the mole size, you have to go from A, asymmetry, B, basically, which would be basically the borders of the
Right, so if you start to see a mole change shape,
exactly.
If you start to see a mole maybe get a little red around the edges,
the borders.
If the mole starts to raise a little bit, correct?
Exactly.
Are these all right?
Oh yeah, the color.
This is what happened to me.
The diameter, the evolution, and that's exactly, when you look at something and say, hey, this is unusual, maybe I need to take a look at this a little bit more carefully and have a dermatologist examine it.
And here's the thing, mine was on my right thigh where I could see. If it were on my back, I'd be dead, because I did not go once a year to see a dermatologist that knows skin cancer. There's a difference.
There is.
You have to go to a dermatologist that knows skin cancer and get what they call the naked check. Just literally have them check every part of your body, because you can get melanoma in the strangest places.
And that's the thing too, is that men typically get it on their back, women on their legs. But again, if you can't see it, how do you know how bad it is?
So you got to have a doctor.
You have to have it evaluated.
Great information, Dr. Iyengar. Thank you so much. And we're going to put all this up on our website, daytimeonline.tv, and get your skin checked. Cindy?